Okay, my name is John Pispidikis. I'm in cohort 7, and we're going to be performing the exam portion of the assessment today. The overall, the health history has already been performed and will be emailed to you in a Word document. In the examination, we would initially perform sort of a general overview. The overview would consist of observing the patient as they're walking into the room. We'd observe their ambulation. Perhaps when they're sitting down, we would observe their transferring. We would take a look at the overall skin temperature, circulation, level of consciousness. If we found that the level of consciousness needed to be examined further, we can do a mini mental health questionnaire. We would also observe orientation in time, place, and person. We would then get vitals consisting of core body temperature, which should be around 98.6 degrees. We would get pulse, usually that's radial. Respiration should be between 12 and 20 breaths per minute. And then the blood pressure in systole over diastole. We would take the person's height, the weight, and the body mass index. Body mass index is weight in pounds times 750 over their height in inches squared. Then we would also do visual acuity, and we could use the Snellen eye chart to perform this. Moving downwards, we would do the we would then perform the head and neck examination. We would perform the ears, eyes, nose, and throat evaluation. We can start by doing checking temporal pulses, then looking at facial expressions, looking at the skin, the scalp for any lesions. We would then look at the pupillary response using a pen light, and then we would have the patient look in H in space to evaluate cranial nerve 3, 4, and 6. We would then look at the conjunctiva and the sclera to see if there are any color changes in the eyes. When evaluating the ears, we would perform the Rhine and Weber test, and then we would look through an otoscope in the ear. Then we would observe the mouth and the oral mucosa, then palpate the neck for pulses. The carotid pulse should be just in front of the sternocleidomastoid muscle. We would also palpate for lymph nodes. If the patient was complaining of any neck pain, we could do a range of motion of the neck, and then also observe for any jugular vein distension. With respect to the upper extremities, we would palpate the brachial and radial pulses bilaterally. Then we would look at the condition of the skin, see if there's any edema in the upper extremities, look at the integrity of the skin as well as any turgor. We would also perform capillary refill and see if that is less than 2 seconds, which is normal. Then we would assess the patient's strength of the upper extremity by doing hand grasps and then arm strength. And then you get more specific. If they have problems, you could test deltoid muscle and bicep or tricep. Then we would do a dermatome evaluation bilaterally, and then if they had any complaints in the upper extremity joints, we could do range of motion of the wrist, elbow, and the shoulder. Then we would examine the anterior and posterior chest and abdomen. The sequence here is inspect it, then auscultate, then palpate. So during the inspection of the chest and abdomen, we would look at the skin, see if it's intact, any lesions or any scars. Then we would auscultate the abdomen, listening for any bowel sounds. If they have increased in bowel sounds, if it's hyperactive, those are called Bergburgmi. Then we would listen for any bruits and any venous hums. Then we would auscultate the anterior and posterior chest for any abnormal breath sounds. Listen for the heart rate. You can get the apical pulse. Again, listening for the intensity, the frequency, the rhythm, timing, and if there's any splitting of the S1 or S2, or presence of S3 and S4 or any murmurs. Then we would palpate the chest and abdomen for tenderness, any guarding, or any masses. We would then move to the lower extremity, and we would palpate the femoral artery, the popliteal artery, and the pedal pulse. We would do that bilaterally. We would then evaluate the length of the lower extremities as well as the position of the legs. The length of the lower extremities is measured by measuring from the ASIS to the medial malleolus. Then we would look at skin condition. Again, evaluating, as we did in the upper extremities, if there's any edema, especially in the lower extremities. You could have a pitting edema. We would also evaluate the hair distribution in the lower extremities, so we can correlate if there's any peripheral vascular disease. Then we would evaluate the leg and the foot strength. Also do deep tendon reflexes in the lower extremity, so we could evaluate the patellar reflexes, which is L4, the hamstring reflex, which is L5, and the Achilles reflex, which is S1. And then evaluate the dermatomes bilaterally, compare them bilaterally, and evaluate sensation at the same time. We could evaluate vibration, we could evaluate pain sensation or joint position sense, and then of course if they have any complaints in the lower extremities, we could do range of motion studies on the ankle, the knee, or the hip. That's the end of my examination. Thank you.